Hi, good morning to all. I am Prof.Manavalam working in SNS College of Nursing. Today we are going to see a feto-pelvic relationship. As a midwifery, we must know the feto-pelvic relationship. So, it is nothing but how the fetus placed in or positioned within the uterus during the time of pregnancy and childbirth. So it is very crucial one, the midwifery, they must know about the feto-pelvic relationship. By knowing this, we can early identify the complication. We know the progress of labor, how it is happening. At the same time, we can find the disproportion between the fetus and the pelvis. Through that, we can avoid the complication. And sometimes it is guiding to take initial management. It is very essential to prevent the complication. At the same time, in order to know the well-being of the fetus, we must know the feto-pelvic relationship. So there are different aspects are there in feto-pelvic relationship. So in that, first we have to going to see about the first relationship, that is lie. The lie, it is refers to the relationship of the long axis of the fetus with the long axis of the uterus or maternal spine. So that is called as, it is a relationship between the long axis of the fetus with the long axis of the maternal spine or uterus is called as a lie. The most common type of lie is longitudinal. This is considered as a normal lie. Sometimes it may be vary as a transverse lie or oblique lie. If it is becoming as a transverse lie means definitely the position getting changed, then the progress of labor is difficult. So these are the very key points to know about the lie. Second relationship is presentation. So presentation means the part of the fetus which occupies the lower pole of the uterus, that is the pelvic brim. It is called as a presentation of the fetus. So there are the different types of presentations are there. First one is the cephalic presentation. It is considered as a normal presentation. 96.5 pregnancy end up with the fetus end up with a cephalic presentation. Next, podalic presentation or breech presentation. Here the buttocks that is lies in the lower pole of the uterus. There are 3% of chances are there to become as a podalic presentation. Next, third one is shoulder presentation. It is present in case of transverse lie, what we have seen earlier slide. In this, the fetus lie in a transverse position. So automatically it is becoming as a shoulder presentation. The shoulder that is lying in the lower uterine pole. So that there is a 0.5% of chance to become as a shoulder presentation. Sometimes if in case of multiple 2 or more fetuses that is present inside the uterus means there is a chance of compound presentation. One may be a cephalic presentation, another may be a breech presentation or shoulder presentation. Again, in cephalic presentation itself, based upon the attitude, it may be present as a vertex presentation, brow presentation and face presentation. So vertex means the occiput is present, brow means the frontal lamina is present. In case of face presentation, the mentum is presenting part. Next, move on to the presenting part. Presenting part means it is defined as the part of the presentation. So we seen earlier there are different types of presentation. Cephalic presentation, podalic presentation, shoulder presentation. In that, part of the presentation or part of the bone which overlies the internal os is felt by the examiner, that is called as a presenting part. So take as an example, in case of cephalic presentation, that is considered as a normal presentation. In that presentation, the presenting part may be the vertex. So the presenting part may be the vertex in the sense the head that is lying in the lower pole of the uterus. In that the vertex, the point that is one particular point of the fetal skull that is present in the lower pole of the uterus, that is called as a presenting part. In case of bro presentation means automatically the frontal eminence which will be lying on the lower pole of the eminence. In case of face presentation, the mentum is lying on that area. So the presenting part, it is mainly depending upon the degree of flexion of the fetal head. Next, move on to the denominator. There may be a relationship between the denominator and the presenting part. So the presenting part also, the part of the fetus which will be the fetal skull which will be lying in the lower pole of the uterus. At the same time, the denominator means the particular arbitrary bony fixed point. They are here, they are mentioning the particular arbitrary bony fixed point on the presenting part which comes in relation with the various quadrants of the maternal pelvis is called as a denominator. There are different arbitrary bony points are there in the fetal skull. Take as an example, back side of the fetus, the occiput is present. The center of the fetus, the vertex is present. In front of the fetus, the forehead, the frontal eminence is present. In chin, the mentum is present. The back come down. In lower segment, the buttocks, the sacrum is the presenting part. It is acting as a bony prominent area. Then it is called as a denominator. In case of shoulder, the acromion process. So these are all the parts of the fixed part of the bones are called as a denominator. It is nothing but the arbitrary bony fixed point of the presenting part which comes in relation to the various quadrants of the maternal pelvis. Based upon these only, they are determining the position that we have seen in next slide. So the following the denominators are for the different presentation. Take as an example of in cephalic 3 presentation we see vertex presentation, brow presentation, face presentation. In case of vertex presentation, the occiput will be the denominator. In case of face presentation, the chin or mentum will be the denominator. In case of brow presentation, the frontal eminence which will be the denominator. In case of breech or buttocks or podalic presentation, the sacrum, the bone, sacral bone is the the fixed point is called as a denominator. In case of shoulder presentation, the acromion process is called as a denominator. Next, move on to the attitude of the fetus. So attitude means the relationship between the different parts of the fetus with one another is or each another is called as a attitude of the fetus. So the common attitude of the fetus is complete flexion. So this considers a normal attitude of the fetus. Here the complete flexion, the fetal head is coming and touching with the fetal limbs. So that is called as a complete flexion. There may be a relationship between the fetal head with the fetal limbs. So that is called as a complete flexion. It is present in case of vertex presentation. In case of brow presentation, there may be a partial extension. So it is deviating or it is deviating away from the head is deviating away from the fetal limbs. In case of sinciput or in case of face presentation, there may be a complete extension which will be present. Completely it will be getting extended. The fetal head is getting extended. There is no relationship between the fetal head and the limbs. In case of centipede, there may be an incomplete flexion. It is partially, there may be a relationship between the fetal head and the fetal limbs. So these are all the different attitudes. In that, the normal attitude of the fetus is complete flexion. It is present in case of vertex presentation. Next, move on to the position. So position, the relationship between the fetal skull with the different landmarks of the pelvis is called as a position. So the relationship between the fetal skull with the fetal denominator with the landmarks of the female pelvis is called as a position. In case of vertex presentation is considered as a normal presentation. In that, there are different types of positions are there based upon the part of the where the denominator is located, in which landmarks of the pelvic brim which will be located. Based upon that, the position may be vary. First one is left occipito-anterior. Here the occiput is the denominator in case of vertex presentation. This occiput that is present in the anterior part of the pelvis, mainly it is present in the iliopectineal eminence, left side of the iliopectineal eminence. So that is why it is called as a left occipito-anterior. This is considered as a normal position. Next, if it is the occiput is placing in the right iliopectineal eminence, means then it is called as a right occiput. At the same time, the occiput that is placed in the transversely in the iliopectineal line, it is placed in the left side of the iliopectineal line, means then it is called as a left occipito-transverse. If it is right iliopectineal line, means then it is right occipito-transverse. It is not considered as a normal position. Next is sometimes the occiput that is placed in the posterior part of the pelvis, then it is called as a left occipito-posterior or right occipito-posterior. This is one type of malposition. It is not commonly present. So these are all the different positions that is present in case of vertex presentation. Next, in case of face presentation, there may be a 3 left. If it is the mentum that is present in the left iliopectineal eminence, means the left mento anterior. If it is right, means right mento. If it is mentum that is placed in the posterior part of the pelvis, so in the near to the sacroiliac joint, means then it is called as a right mento posterior. In case of brow presentation, the frontal eminence that is present in the either part of the anterior part of the pelvis or posterior part of the pelvis. Based upon that, it may be having the anterior part, anterior brow presentation, posterior brow presentation. At the same time, shoulder also, whether it is present in anteriorly or posteriorly of the pelvis, relationship with the pelvis. Based upon that, it is also called as a anterior part and a posterior part. Next, the sacrum, the breech presentation, it may be anterior. Again, it is present in anterior or posterior. If it is present in anterior, then it is left sacro-anterior or right sacro-anterior. If it is present posterior, then it is called as a left sacro-posterior or right sacro-posterior. I think everyone understood about the feto-pelvic relationship. Thank you all.